Okay, good afternoon, everybody. Welcome to this UKFPO webinar, second in our series this year. And I'm pleased to say that if any of you missed the last one, it's now up on the website. You should be able to find it there. So this afternoon, we're going to deal with things, more assessments and about the PSG and summary narrative. And I'm going to start by introducing my presenters. Start with Fiona.
Thank you. Good afternoon, everybody. My name is Fiona Cameron. I am the Foundation School Director in Scotland, and thank you for joining this webinar.
Thanks, Fiona. And Aisha.
Hi everyone, my name's Aisha Najamuddin. I'm an FY2 in Manchester and I am a UKFPO Leadership Fellow this year.
And I'm Tony Choules. I'm advisor to the UKFPO, and I'm just going to make a small introduction and then we'll go on with the key presentations. I should just say before I start that there is a Q&A function on this webinar. You should be able to put some questions in, and we hope to have plenty of time to answer them at the end. So I'm going to share my screen and it will take a moment to come up. Good. I've come up in a slightly different order. Can I just check that my presentation is up on the screen? Thank you, Aisha. Good. So, as I say, we're going to talk about the evidence for the portfolio. We're going to particularly concentrate on the PSG this afternoon and the summary narrative, but we will be mentioning the tab. We often get some questions about the overlap of these. Just a quick reminder about the background of Foundation and why we're doing all this. Part of medical training, and like all training programs, there are requirements to be completed for Foundation doctors to pass out at the other end and go into either further training or other roles. The standards are essentially things that are approved by the GMC based on good medical practice. There are 3 higher level outcomes, and if you look in the curriculum, you can see that these are broken down into clinical skills, sort of healthcare worker skills, team working, and then there's a section on professionalism. And Foundation doctors are required to provide evidence of their abilities in these areas, their Foundation capabilities, in order to satisfy the requirements of the training programme. They are expected to do this in different areas, both acute care, in physical health, in mental health, and in community care and other settings as well. And there's supposed to be an understanding of the whole biopsychosocial model, or physical health, mental health and social health. And the Foundation's doctors do this by demonstrating their abilities in the workplace. And you can see on the left there, the green triangle showing the evidence that we like Foundation doctors to produce to show that they're able to, or that show they're capable of doing those 13 areas. It is mostly an experiential learning program, and my feeling is if you're Foundation doctors should be working in the clinical environment and should only really need extra training in things that they don't encounter in the clinical environment. So often things that aren't perhaps widely practiced or are new to medicine that need development. And that's not to say that Foundation doctors in hospital should spend all their time on the wards. This is being part of the entire clinical team. So in a surgical placement, you might go to theatre. In other placements, you might go to clinic. Then there's MDT meetings. You may go for therapy sessions, a variety of different opportunities there. And I think it's really important that Foundation doctors take the opportunity to do this and are given the opportunity to do it as part of their training. The programme is made up of foundation doctors demonstrating their skills, and we covered that to some degree last time when we talked about the SLEs. And as I say, the webinar, if you missed it, is available on the website. It's also about getting feedback from the professionals that foundation doctors are working with. And we have this concept of the placement supervision group, the PSG, which provide feedback in an ongoing process to the doctor through the placement, and then at the end would be invited to provide some more formal feedback that can go in the portfolio, and this is done by the clinical supervisor, and this is something that we'll discuss as part of this webinar. Just talking about the portfolio, we expect our foundation doctors to gain evidence in a variety of ways, and I've mentioned the SLEs. There's also learning, core learning, and as I say, in this webinar we'll be talking particularly about multi-source feedback from colleagues and from other professionals. All this is, or for those who aren't familiar with the process, all this is reviewed, or the e-portfolio is reviewed at the end of the year at something called the ARCP, the Annual Review of Competency Progression. And all trainees have to do this once a year, regardless of whether they're full-time or part-time. And it's just really a review of training and an assessment of whether the trainee is prepared to move on to the next stage of training. Details of exactly what's required for the ARCP can be found in the curriculum, which is on the UKFPO website. There's not a very long list. There's just those 2 slides worth there of the things that need to be provided by the end of the year, or in fact by the end of May, because June is usually the time that ARCPs are done, ready for the GMC to register, certainly the F1s, from the beginning of July. And finally, really just to perhaps make foundation doctors on the call aware of sort of why we do this. Yes, it is about the monitoring training, but I as a senior doctor, I'm a paediatric consultant. Every year I have to provide a portfolio of evidence in my appraisal to show that I'm doing a good job. That may well include patient feedback, colleague feedback, evidence of my involvement in incidents and so on, and evidence of my ongoing learning, my CPD. So it is something that goes all the way through medicine. And as part of the submission, I have to write a little summary of some of the things I do against the domains of the GMC's good medical practice, very, very similar to the process of the summary narrative. So that's my introduction over. I'm going to come down and just unshare my screen, and Tamika's going to take us on to the next section. As I say, please do put questions in the chat as we go along.
Okay, can everybody see this slide? Tony, can we see this? Yep, thank you. Thank you, everybody. I'm going to follow on from that presentation with some more information about the tab, the PSG, and the summary narrative. First of all, we in foundation and also in other training capacities, we use a lot of acronyms. We talk about tabs, PSGs, ARCPs, lots of different things. And sometimes people ask, what is that? So the tab is the team assessment of behaviours. And it is different from the PSG, which is the placement supervision group feedback. And they are 2 different things. I'm also going to talk about the summary narrative, which is actually a form of reflective practice. Now, let's have a think about what the difference is between the tab and the PSG, because they are both forms of feedback to help you learn, to progress, and inform your development. We can't use them interchangeably because the PSG and the MSF tab are assessing different competencies, different aspects of your communication and your foundation and your performance as a doctor. And I'll talk through each one individually. So first of all, we'll deal with the tab. You may have had this as an undergraduate. Your medical school may have asked you to do this, or you may not. This is an assessment of your communication, and it looks at 4 domains: your accessibility, your communication, and you are asked to also provide self-feedback on how you feel you are performing. Sometimes we see foundation doctors think that they're underconfident and put themselves as having some concerns, and that doesn't match at all as to what the feedback is, and they get very good feedback, which can be very, very nice to receive. As the foundation doctor doing a tab, you choose your colleagues from all grades in one placement. And you will get feedback on professionalism, your attitudes, your behaviours, how professionally you behave in the clinical environment. It doesn't give you feedback on whether you are clinically competent, on your professional skills, on your diagnosis, or on any of your procedural competencies. It purely comments on how you communicate and how you perform within the team. You won't see all the feedback initially. The summary comes to your educational clinical supervisor, who will then release the feedback to you. You will be able to sit and talk with your supervisor around the feedback, and you won't know which member of staff has given you that feedback. You might be able to work it out, but it will all be anonymised. So you should do at least 1 tab in your training year. It's up to you and your foundation school as to which post you do it in, but I would suggest you do it in either the first or the second, because if there are any concerns, you really haven't got the time to repeat it if you do it in the 3rd post. So I would suggest either post 1 or post 2 for your tab, and it's your responsibility to send out the tickets. You need at least 10, so you probably should be asking for about 14 or 15 to assure that you get 10 back. Now, looking at the PSG, the Placement Supervision Group feedback, that is more concerned with how you are performing as a doctor. So it relates to all of the 13 FPCs. So your people will be asked to provide you with feedback on your clinical competence, on your communication as well, your maybe involvement in QI, and also your portfolio and how you're learning. So it's your supervisor, your clinical supervisor in one post chooses senior colleagues. They can be senior medical colleagues, nursing colleagues, pharmacy colleagues, but senior colleagues in one placement that contribute to your placement supervision group feedback. We heard very strongly from previous foundation doctors that they really value the feedback that they receive from the PSG, as it is helpful to them progressing as a doctor and can be very useful when they're applying for specialty or general practice training to demonstrate that they are a good, competent clinician. Again, you won't see the feedback initially. The summary is created by your clinical supervisor, and that helps them inform their end of placement report. You will get to see the feedback, and again, it will be anonymised. And again, you may be able to work out who has given that feedback, but you shouldn't be able to identify who they are. Again, you need at least one PSG in your training year. And again, I would suggest post 1 and post 2 are the best places to do that. It is possible to do them both in the same post, but I would caution against that, because if you do them in 2 separate posts, then you get a wider range of feedback to you. I'm now going on to the purpose of the summary narrative. The summary narrative is, as Dr. Chules has said, a little 300-word maximum summary of your training and your progress, and it allows you to look at what you've got in your portfolio and to critically appraise it and to write a little summary supporting why you think you should be signed off for each of the higher learning outcomes. It will helpfully prepare you for future, because when you move into more advanced training into specialty or GP, you will have to do this. And as Dr. Chules has said, as a consultant, I am required to do this every year as well. We're not looking for a huge essay, just a 300-word summary of your progress as to why you think you have achieved the HLO. You can also put areas of excellence. You can use it as your boasting box, essentially. Put all the things that you feel you have done well in your summary narrative. And you will need 3 summary narratives, 1 for each HLO, but within the portfolio, they actually all sit on 1 form. It's a formative assessment. Your supervisor will review it and assess it, but it is not pass-fail. They may give you advice into how it can be improved, but it won't be something that they decide whether you are going to progress or not based on your summary narrative. Thank you for listening. I'm now going to stop sharing my slides and move on to Aisha. You're muted.
Apologies for that. Can you still see my screen? Sorry about that. So as I said earlier, my name's Aisha. I'm an FY2 doctor and I currently work with the UKFP as a leadership fellow. My talk is to give you...
Aisha, the screen's gone.
Your presentation's disappeared.
It's disappeared.
Oh.
It was there and then it's disappeared.
Sorry about this, everyone.
Yeah, you're back on.
Right, third time lucky.
You're in presentation mode, yeah.
Can you see my presentation, and hopefully you can hear me as well? So my presentation is to also give you an overview of the TAB, PSG and Summary narrative from a slightly different perspective than what Dr. Cameron's kind of just done. So I'm going to kind of go through with you, I'm going to give you a brief overview again of what we do as foundation doctors and things to be aware of, and maybe if things aren't going so well, how we can approach that as well. So to start off with the TAB, as we've said already, it's multi-source feedback. The UKFPO requirement is for 1 per year. However, I would check your local ARCP requirements, because in my foundation school, we have to do 2 per year. So we have to do 1 in placement 1 and 1 in placement 2. As Fiona said, I definitely wouldn't be waiting until placement 3 for a lot of these things, because your ARCP, so your portfolio is usually locked by the end of May. which only really gives you half of your third placement to get any of these things done. And it may be quite difficult, especially if you're waiting for people to fill out these forms. So as we said, we are the ones that send out the requests as foundation doctors. And I think it's good practice to ask people if they would mind filling it out for you, for two reasons. Firstly, it's polite. Secondly, it also gives them some prior warning that they are going to receive something, and they'll be expecting that, that survey link through. Certainly, just purely anecdotal, but sometimes when I've been sent some of these things by surprise, sometimes by some of our medical students, it's not kind of on my radar and it gets buried under email. So we want to make sure that, this person is aware that you're asking them to provide feedback, and that they're also aware that there is a time limit on it because your tab is only open for 45 days. 10 responses. It doesn't sound like much, does it? But bear in mind, people are very, very busy. And like I said, sometimes it's not kind of at the forefront of their mind. So you may have to chase people. There is an option within your portfolio. So when you send out the request, you can send it out again. So say if you've sent out the request and you've noticed some people haven't responded for 2 or 3 weeks, you can send out another reminder and that will send them the link again. So the feedback is anonymized to you. So when your educational supervisor releases your tab, you're not going to be able to see who's made the comments. However, your educational supervisor can see the non-anonymized feedback. And they will release the tab to you once you've got enough responses. So the reason that I've kind of mentioned about who it's anonymized to is that this is very unusual, and the vast majority of us where we get good feedback, but sometimes you may be surprised by what you read, and sometimes it may be it's surprising, upsetting, and you don't know who it's come from. If this were to happen, so your educational supervisor is going to know about this before you do, because they will have already seen your tab. So you'll discuss the feedback with them. If you need any further support, depending on what it is, what has been raised, you can approach your clinical supervisor or any other senior that you feel comfortable with. I've put sort of query discussing the feedback with the colleague directly. It's going to depend on the context of what has been raised, what has been said. But I think something that's always really important to think about is it's not nice sometimes reading something that's maybe slightly negative about you or is written in a slightly blunter manner, but there is something to learn from that, because you know how you behave from your perspective, but other people are, watching you, and that they gain a different perspective of your behaviour. And sometimes, when we're stressed, when we're under a lot of pressure at work, we behave in ways that, sometimes you don't even realise that you are doing or saying certain things. So try and, certainly seek the support that you need to both, sort of manage the feedback from a personal point of view, but also to develop. And learning points as well. I'll also say, when you get that positive feedback, have a good look at it and think, I'm doing this well, and make sure you're kind of like reinforcing those behaviours and understanding what you're doing well and how you can continue doing that as well. So moving on to the PSG. Again, so this is different because you send out your tab request, but your clinical supervisor sends out your PSG feedback request. And so you and your clinical supervisor need to identify 2 other senior colleagues within your team that can provide you with this feedback quite early on. Because the idea is, yes, they fill out the form, but there should also be 2 or 3 senior colleagues that you work with frequently who kind of get a better sort of overall view, as Fiona said, your clinical capabilities, other sort of portfolio work that you're doing, such as QI, research, teaching, and that sort of thing. So if those, I think in most cases, your placement supervision group should be identified at your initial meeting, but for whatever reason, if it's not, please do make sure that you are discussing that with your clinical supervisor early on. You will need 1 completed PSG per year. However, again, just check your local ARCP guidelines, because there may be some foundation schools that want you to do 1 per placement. And so one thing that's really important about this is that we all kind of have a bit of a different interaction with our clinical supervisors, and certainly in some placements, I haven't really had the opportunity to work closely with mine or see them at all, really. And so I had to be very kind of proactive in emailing my clinical supervisor, reminding them to please send out the feedback requests, because it does need to be done. It's mandatory for you to complete your ARCP, but it's also the clinical supervisor is meant to be able to also base their end of placement report on that feedback as well. And again, sometimes when you may receive some feedback that you are surprised to see or is a little bit distressing. So again, because the feedback is anonymised to you, but it's not anonymous to your educational and your clinical supervisor, so you'll be able to discuss things with them. They may or may not tell you who has made which comment, and depending on the context, that may or may not be appropriate. So that's why I've also put, it's possible that you may discuss the feedback with the colleague directly. And again, it's always really useful for both good and bad feedback to think about those learning points, and if there's anything, that we can improve upon, anything that within, the context of comments that may have influenced it, your own, sort of personal well-being as well. And there are other areas of support beyond your supervision directly, such as your education, your clinical supervisor or other colleagues, of course, family and friends. But if there was, something else that's ongoing and you feel like it is influencing your performance at work, there is access to the Employee Assistance Programme through all foundation schools. This is a free support service that any of us can access at any time to gain support such as counselling and other things like that. Of course, you can always approach your GP. Depending on what the context is with some of the issues, it may be that there's some more local training provided, and there's also the e-learning for health modules that can help you with sort of further e-learning for either clinical things, and there's also some wellbeing modules on there. So the summary narrative, it's important to, and I think this is something that certainly I and a few of my colleagues didn't quite understand at the beginning of the year. This is a live document, and you should really be updating it as you go along throughout the year. So for each higher learning outcome, it's a 300-word paragraph. And the idea is that updating it regularly, it gives you time to kind of look at the evidence that you've presented in your portfolio, look at what may need further development or you may not have provided evidence for, and then so you can comment on, you've met these requirements because of these areas of evidence, you're aware that you need to develop on this, and so because of that kind of constant editing of this summary narrative, it helps keep at the forefront of your mind what your own learning needs are as well. So I have borrowed this from the UKFPO's website. So here is an example of a summary narrative for HLO1. As I said, there is a separate summary narrative for each HLO. So you can see here this candidate has separated their summary narrative for end of placement 1, 2 and 3. When I wrote mine, I didn't quite do it like this, but I did make an effort to kind of make it obvious that which placement I was within when I was writing about the evidence that I was reflecting on to link it to the curriculum. So you can see here that this person, again, I won't dwell on this for too long because we want to move on to the Q&A. This is freely available for you to read. You can see that they have identified some areas, say by the end of placement 1, that they need to find some an FPC to link an SLE in physical and mental health. And they've been very honest and said, I'm a bit behind, but we'll work on this. And that sort of thing is good. It's showing your ES who will read these summary narratives that you made that recognition early on of what you need to do. And as we go through, we can see there that the foundation doctors made some comments on their progress, what other SLEs they've linked, and some other areas that they may need some further learning in and what they're doing to sort that out. So just as a summary of the summary narrative, so it is the value in this really is that continuous updating of it, because the rest of our SLEs, you know, you have someone supervise you doing something, you discuss it at the time, you send them the form, and then you can reflect upon it at the time, but after that, unless it's linked to something else, sometimes that area of reflection kind of comes to an end. But this summary narrative helps you keep thinking about what you're doing, what you're learning, and what your further learning needs are, and also how to solve them as well. And it is formative. That's really important to remember, because so you have to produce your summary narratives for each HLO, but it's not used as part of your main ARCP. Apart from the fact that they are present, is what I meant, sorry. So some take-home points for you. This always goes without saying, and it's very easy for it to fall by the wayside when you're busy and you have a lot of different things that's going on, but it's really important to be organised and to do things as you go along. You do not want to get to May and, you know, realise that you're missing evidence for, you know, half the FPCs and be rushing around and trying to look for opportunities. And as you're going along in your placements, look for opportunities for these, you know, these learning opportunities, and always be looking at the curriculum and thinking about what you need to demonstrate that you've met that evidence. And as our consultants have said, this is a process that will follow you through until, well, forever pretty much, because there's always, you know, portfolio throughout specialty training, and then you do appraisals when you're a consultant. Don't be afraid to remind colleagues to fill out forms. Like I said, sometimes, unfortunately, people are very busy and you do have to chase them. But this is necessary in order to make sure that you get enough evidence. And, you know, you can email colleagues. If you run into them in person, you can just remind them. I'm often, you know, sometimes it's a case where sometimes someone has bumped into me and said, oh, you know, please, can you sign this off? I sent this to you. And then I think, yeah, of course. And, you know, I try and do it that day. Being aware of deadlines in the year when you have to meet them. So as I said, your tab is only open for 45 days. So if it's opening around now, the moment that you've submitted your self-assessment and sent off some tickets, you've got 45 days to get those 10 responses. And of course, there's other deadlines in the year for your ARCP, and knowing that your portfolio will lock before that. It's often at the end of May, so you don't have as long to do everything as what you often think you do. This kind of fits alongside with the summary narrative, but like I said, identifying your learning needs throughout the year and planning to meet them early. And if you update your summary narrative, that will help you with that. And to, you know, just really make use of your senior colleagues in you know, managing your feedback and your learning needs, because there will be things that come up as you go along in your placements that you didn't even realise that you know, you either wanted to learn more about or needed to develop in. But this is the whole point of, you know, why we have the supervision system as we do as foundation doctors. So it's really important to take it as a really good opportunity to learn. And that is the end of my presentation.
Thank you very much, Aisha. Very useful summary there, hopefully, for everyone. There have been a number of questions coming in through the chat, which we have started to answer, but I think it's useful perhaps to recap on some of those issues. The first question, I think Aisha did cover it in her presentation, but how do foundation doctors know that they've got the 10 replies or the correct 10 replies?
I think when you go back into your tab, it will give you a notification that you have enough replies, because you can actually see who hasn't replied. So just by sort of simple maths, it will tell you once all of the separate sections within the different staff groups will go green when you've got enough responses for each.
Thank you. I think it's a good moment to point out that we do have 2 separate portfolios. We have Horus in England, and then Turas in Scotland, Wales, and Northern Ireland. So their functionality is very slightly different, but that's true of both the portfolios. They will just look slightly different. The next question was about the numbers of tab and so on, and I'm interested that Aisha has to do an extra one. The standard national requirement is for 1 tab and 1 PSG per level of training. So one of each in F1, one of each in F2. We do strongly encourage supervisors to use the PSG in each placement if they can. It's sometimes a little bit impractical in the third placement, which is quite often quite short by the time we're looking at evidence. But I think it's a really good thing to do, and it gives broader feedback to the foundation doctor, because it's not just one person filling in their clinical supervisor report. There's a bit more feedback there. Fiona, there was then a question, or actually I'm not sure it was a question, but you mentioned a little bit about upsetting feedback, and Aisha mentioned about upsetting feedback. I wonder if you'd like to give a sort of trainer response on that one. I know when I see slightly odd comments in tabs and PSGs, I often go and speak to the person to try and find a little bit more information. But do you want to expand on that, Fiona?
Yes, your supervisor will see all the comments before you see the comments. And if they can't see why you might get that comment, then they will go and speak to the person who made the comment. And you would never just be sent all the comments to see electronically. Your supervisor should sit with you, and then you can see why you think you might have got that feedback, why that's happened, and it often forms the start of a conversation. Sometimes it's just a bad day. Sometimes it's just a personal interaction that hasn't gone well. But it's good to reflect on it and to know to think, why might somebody have said that? It's also quite helpful if you have comments that are slightly surprising and you didn't expect them, is to then repeat the tab in a subsequent post after you've thought about why you might get that feedback, and then look and see how things have improved. I think all of us have had some feedback over the years where we've thought, I didn't realize that I did that, and modified our behaviors on top of that. So it's very likely that most of you will have positive feedback throughout, but there might be the occasional comment that you think, okay, perhaps I can do better. It was maybe not a good day, but I need to work out how I'm going to behave differently when it's a bad day. But your supervisor will sit with you and give you support if you need that kind of support for the feedback.
Thanks, Fiona. I think that's helpful. Yeah, I think we all sort of have blind spots, and that's part of the point of the training. And you don't have to be perfect to pass foundation. I think that's fair to say. There's specific requirements about the tab about if there's a slight concern here or there, that's fine. And the same for the PSG. In fact, your educational supervisor will take it into context. If everybody was fabulous and fully trained from the start, we wouldn't need a training program. So that's the purpose of it, and it is designed to broaden it. And after many years in the NHS, I still stumble into areas where I think something should be done one way, and somebody very clearly explains to me why, from their point of view, it should be done a completely different way. And the NHS and healthcare is a very complex system. Thank you. So we'll just move on. There was a question a little bit about grades and seniorities. I think most of that's covered in the tab. There's no specific requirements on PSG. It's just other people you have worked with. And there was a question on why I think it was largely centered around why foundation doctors are in other health professionals on the drop down boxes, and that's purely because we want feedback from a variety of different people, some of which will be senior doctors. You don't specifically need to request it from your foundation colleagues. You may choose to use other people, and that's why it's in that group. But in terms of seniority, you should be able to meet with people, you should be able to ask people that you interact with. It's quite unusual. There's a question about the single consultant. It's quite unusual that you'd spend your entire 4 months with just one senior. There may well be locums covering, you may interact with other wards and other consultants. So it should be possible to find a senior doctor that you can get more feedback from. I don't know if Fiona wants to add on to that.
No, I think you've summarised it fully, Tony. I don't think there's anything else to add there.
Thank you. Okay. And similarly, there was a question about a little bit about who should we ask for it. I mean, it is literally anybody that you work with, and you can get feedback from a variety of people. Pharmacists are likely to comment particularly on your prescribing skills. The nursing staff may well comment more on your team working ability, and hopefully the senior doctors will concentrate more on perhaps your clinical skills as well as some of the other areas. So it's designed to try and create a sort of balance, really. I'm not sure if any more questions have come in while I've been talking. There do seem to be a couple more. Fiona, have you answered a couple and you want to just pick up on them?
Yeah, I've answered one about the UKFP website says you need 2 consultants with the PSG, ideally 2 consultants, but you may well be working in a situation where there is only 1 consultant. You may be in general practice where there are small numbers within the team, and really the supervisor will decide where they're going to ask for feedback. We are not so prescriptive within the PSG. It's from the senior team to give you as much feedback as possible, and obviously we understand that some departments are very small and some are very large, and you may be working with different numbers of people, so the supervisor will make that decision as to how many people that you get. Ideally, you want them to be relatively senior and have seen you work so that they can give you appropriate feedback. There's also another question about adding more people later after you've submitted the initial 10 people from the tab. I was hoping Aisha might answer that. I think once it's released, you can't. Would that be right? But before it's released, you can. But I'd ask Aisha for the information here.
So you can request, you can add people to fill out your tab until the tab is released to you. So if for whatever reason, if you don't get enough responses, your ES can still release that, I believe, but you can't add people to it afterwards if you've only got 8 or 9 responses. However, in the time that it's open for, in your 45 days, say if you send out 10 initially and only half the people respond and you find some other colleagues that are happy to fill it out for you, you can add them on later.
So from the supervisor's side, we get them back and we have a button to click in our portfolio, which summarises it for us. And that will give us the list of questions. And as Aisha said, until we publish it, we can just press re-summarise if more come back. But once it's released, that's it. There's another question about tab across 2 placements. The answer is no. It's supposed to be done in 1 placement. One of the reasons that we continue with the tab is it's very well validated. There's been quite a lot of research done on the feedback and its ability to pick up particularly doctors that are struggling. And so it's something that we rely on quite heavily, and all that work has been done largely on feedback from 1 placement. Or there's another question, how many required for the PSG? In an ideal world, we'd like at least 3 people to comment on the abilities of a foundation doctor within a particular placement, because as I say, it's about fairness, really, to make sure, because if your supervisor perhaps hasn't seen you that much, may have seen you on a bad day and the rest of the days have been great, then we'd like that to be reflected in your feedback. So yeah, I say ideally we suggest about 3, but there is no minimum number, and in some places it will just be the supervisor and 1 other. I'm not sure. Oh, there's any more coming in? And the one comes for your PSG.
There's another question about the same rotation.
Oh right, go on then.
Yes. Yeah, so there's nothing to stop you doing a tab and a PSG. This is a question about what to do. Can you do the tab and the PSG in the same placement? You can. However, I would suggest that it's better if you're only going to have one PSG and one tab, then I would suggest you do them in different posts. If you are performing really well, everything's going well, then you're going to get good feedback in that. But if, say, if it's in your first placement, you've still got things to learn, you might find that the feedback that you get is not as positive. Also, I would suggest that you widen the range of people that you get feedback from if you do it in a different post, and therefore it is more useful to you. So I would suggest different posts, but we wouldn't stop you doing it in the same rotation. I would also suggest that you probably do the tab first, but I don't think it really matters.
Thank you. There was a question of what if you don't get the full 10 replies in one placement? Unfortunately, you then have to repeat it in the next placement, and that's why Isha's saying you should be sending out at least 15 responses. And most, well, my experience is mostly people do get the feedback. If they've just kept an eye on things and requested more if they haven't had it, or sent out reminders. So how many PSGs? Well, again, yes, it's one per minimum of one per year for tab, minimum one per year for PSG. And when I say year, I'm working on foundation doctors completing in a year. I realize less than full-time ones may take longer, but the requirements are still the same to make it equal.
It's one training year, isn't it?
One training, yeah. Are there any other questions, Kata, or? Oh yes, Kata's just flagged up. The one consultant in the PSG, your clinical supervisor, will be the one requesting the PSG, so they by definition really are sort of part of that group. But no, we would expect them and at least one other to provide feedback. Okay, I'm just looking to see. I'll give a moment just in case there are any more questions. Oh, there's a couple more just come in.
It's a question about healthcare assistants doing tab forms. It says TAN, I presume it's tab. I would say healthcare assistants can do tab forms, but I would say that healthcare assistants wouldn't be doing PSG forms, because PSG forms are commenting on your clinical care, but a healthcare assistant could comment on your communication with the team and also with the patients and relatives. So yes to tabs, no to PSG.
Oh, okay. Yeah, I think this and there's a question about the list. I think we may need to just change the wording on the tab instructions. Apparently, the functionality has changed, but there's a slight change in the guidance. So we will look at that. Thank you for flagging that up. I can't see anything else coming in. Kata, anything else that we need to pick up on? No. Okay, so I'd like to particularly like to thank Fiona and Aisha for their presentations, and for the UKFPO team in the background. Tamika and Kata have been frantically working away trying to make sure all the technical stuff works. I will announce that this webinar will be on the website probably in a week or two, I would hope. So if anyone's missed it, they can pick up on it or just look at it again. The next webinar is in the second week of December, and I'm very pleased to announce that it's going to be about sustainability in healthcare, particularly about sustainable quality improvements. So we hope you'll all attend that one and perhaps encourage your colleagues to do so. We've got a guest speaker coming in. Certainly when we've looked at what foundation doctors want in the curriculum. One of the things that comes up quite frequently is sustainability and environmental effects of healthcare. So it's something that we're hoping to introduce over the next year, just to I think start the ball rolling, and then maybe incorporate into the curriculum subsequently going forward. So thanks to everybody. Hope you've found this useful, and we'll hopefully see you all again in December.